Thank you for stopping by the Inside Deschutes County podcast. Wherever you might be and however you might be listening, we appreciate you making us a small part of your day. We hope you click those subscribe and download buttons, and be sure to catch us wherever you listen to your podcasts. You can also find us on Deschutes.org/podcast.
Deschutes County is an amazing place to live.
Ease of access.
Work and play.
Great place to raise a family.
I love the weather and the high desert.
At Deschutes County, we provide excellent service.
Beautiful.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
This is episode 25 of the Inside Deschutes County podcast. Thank you so much for listening. I'm Eric Breon. Well, we've now moved into spring. The weather's getting a little warmer. More people are out and about, hitting events around town, walking their dogs, riding their e-bikes. And oh, by the way, school season's winding down. So we thought it'd be a good time to get a big update on a very important school program in Deschutes County. My guest today is the leader of the Healthy Schools program with Deschutes County Health Services. Aimee Snyder is here. Aimee, thanks for being here.
Hello, thank you for having me.
What's been going on? I haven't seen you in a while. It's been a few months.
It's been a bit.
You staying busy?
I'm staying very busy. We are busy with work, but we're also busy having a good time out in the sunshine.
Yeah, are you getting out? What are you doing?
Yeah, I got on my new bike the other day.
What? Oh, so you were one of those people.
Yeah.
E-bike or is it a regular bike?
It's a mountain bike. I just got a new mountain bike.
You're a big biker.
Not big, but I went on the easy trail, so it is a nice bike and starting to do the bend
What's an
thing.
easy trail?
I went to
flat,
Maston.
concrete?
It was pretty, not concrete, but
Okay.
it's pretty low on the technical scale. It's green.
Okay.
Yeah.
That's getting out and about a bit.
Yes, it was definitely out.
Well, that's good. Today was the eclipse as of this recording. Did you
I did
stay
not.
up there? Are you a big astronomy buff?
No, I did see the eclipse in Corvallis when we had that.
2017,
Yes.
right?
Yeah, I got to see it then. I got a great picture.
Nice.
Which is rare that you can get a good picture by yourself. So I was able to get a picture and framed it, but I didn't go out for today's.
Oregon not in the path of totality this year. More Texas to Middle America.
Yeah.
So I saw a lot of pictures of clouds.
Yes, I'm sure those clouds were very pretty.
Big bummer for people who traveled to go see. That's what I don't get. But anyway, it's a big deal. It's a big deal. Well, also a big deal, an array of sunshine for the county, is the Healthy Schools program. So that's what we'll talk about today. A lot of misconceptions, I think, about this program. I think a lot of people think it's school lunches. It's not school lunches, is it, Aimee?
It is not school lunches.
So tell us a little bit about this program.
Yes. The Healthy Schools program in Deschutes County is a 50-50 partnership between Ben Lapine Schools and Deschutes County Health Services, specifically our public health service area. We embed our public health staff into the schools as part of the school's staff. We serve as leaders and we help arrange their school health teams and help them assure that the things that they're doing in schools are promoting health for all students and are preventing common things that are emerging in adolescence, like suicide, mental health issues, substance use.
All kinds of issues there,
all
right?
sorts of issues, yeah.
Yeah, so, I mean, vaping,
Vaping is one of them.
probably a big one.
Yes, vaping's a big one.
Drug education,
All
prevention,
substance use.
lots of stuff.
And
there.
then also things like technology use. We help with healthy versus unhealthy relationships, relationship boundaries, things, very common things that emerge in adolescence.
I would think anxiety, depression, probably pretty high on that list too. What do you see the most of? Is there kind of one that rises to the surface there?
Our central focus area is mental health. We're in a youth mental health crisis, and when you look at it, a lot of the other things that occur, like substance use, are really root caused by mental health issues. So if we can work on mental health, better social support systems in place for students, then a lot of the other behavioral things that we see are going to fall into place if they have a really strong coping skill set, if they have social supports that can help them navigate some of those very common normal things that they're going to be challenged with when they grow from being children into young adults.
I saw your team doing some great work at Mountain View High School.
Yes.
They did a mental health week.
Yes.
With lots of activities and stuff. That must have been a big success, I would think, for your program.
Yeah, they just had their second, or at least my public health specialist, her second time helping the school through a mental health week. And she said this year's was a very strong program that a lot of the students were able to take on leadership roles, and she got to see them just flourish as they made plans of what they wanted to do for school-wide mental
That's
health
so cool.
promotion. Yeah, and get to
So
see them
cool.
just kind of grow into these empowered youth leaders.
Yeah, it was so cool because I got to be there and see a little bit of it, and you could see the engagement by the students and how they took it seriously, and the issues themselves, but also the program to try to help the issues, right? I mean, like, you could, yes, we know that these things are important. We also know that taking steps to help are equally as important. It was really cool to see the students involved with the activities with your team. That was pretty cool.
What you described is really a key piece of our program that we for our program, we are based out of the prevention and health promotion program area. So we are really focused on what are the things that we can do to prevent mental health issues from ever becoming a crisis or a treatment issue. So what can we do before it becomes a problem? And that's what you just described of students being there to talk about what are their strengths? How are they able to cope with the challenges that they have? What are the resources and supports that they have? And we always make sure we include, like, where do you go for help? Where can you go for treatment? And we often will bring in those treatment providers like the School-Based Health Center, Deschutes County Behavioral Health, the Mosaic, behavioral health consultants, but we will still focus on the hope, help, and strength that we have that keeps us healthy and well.
I think it's important to note that, you're not treating students at the school, right? It's not an office or a clinic that they're going to. Kind of explain how it works, because it's not that, right?
Yes, we are not the School-Based Health Center. We're not a counselor. We are the policy system environment, which is not a great way to say it. But we work with the admin, the staff, student leaders, families, as well as those community partners like those treatment providers to identify what do we as a school need to do to make sure the school is promoting health overall. So we aren't seeing students for treatment issues. We are really looking at what can we change inside this school so that every lived experience inside this building is positive, healthy, preventative, and engaging, enriching students' lives. So we work with student leaders often to help them decide what do they want to do and to help them navigate what the barriers that the adults often put in their way to make the school a very youth-centered, operation. That's the extent of our student interfacing. We are really working on them becoming leaders and taking charge and making changes. Or we're working with the staff and admin for them to decide what do we want to do to help our students be healthy, happy, thriving, so that mental health isn't a barrier to their learning.
I would think there'd be a big advantage for teachers in this too, because you're almost taking some things off of their plate and
Correct.
allowing them to teach, right? That's got to be a big benefit for teachers, administrators, right?
Yes, yeah. It's been, I would say, the group of teachers that have been most appreciative of our program have been health teachers in the middle and high school levels, because we've helped them identify effective prevention education curriculum. So all they have to do, we make sure they have the curriculum that they need. All they have to do is open it up and teach, and they're effective programs. So we know they work at changing those behavioral issues that they're seeing. And so they don't have to worry about, is what I'm doing the best thing that we could be doing right now? They just open up the curriculum and they teach it. And then we help bring the trainings if they feel like they need a little bit more support.
Are there other programs like this in the state? I would think that this, is kind of cutting edge a little bit.
As far as I know, we're the only county in the state or only school district in the state that has this type of program embedding public health staff as part of the school staff, specifically to do these school-wide, very universal upstream changes. I do know there's other counties in Oregon that have a partnership between their local public health department, and they might have some staff in the buildings. But I think they're doing more of a link to care. So a student that has, or a family that has a specific health problem, they would go to this healthcare navigator and they would help them get it signed up for insurance and help them get to an appointment. So we're not doing that type of care. We're doing more upstream, more systems change, making the schools overall as a public service much more preventative and health promoting.
So I saw you give a very cool presentation to Senator Ron Wyden about your program. Very cool. It was at Bend High School. And his eyes were wide open listening to what you had to say about the program. What kind of support are you getting from state leaders about doing this and kind of expanding it? Are they trying to help you in any way? Are they trying to find additional funding? What's going on in that kind of situation in which they can support you in this effort that's cutting edge?
We've had Oregon Department of Ed and Oregon Health Authority showcase our program as a strategy that other districts could use with the student investment accounts and the it's called integrative planning framework that all districts have to do now. So they've been showcasing us and highlighting us as a strategy that others can do with an existing funding stream. And that's how we get 50% of our funding from the district. It's part of their funding process for the student investment accounts.
Because this is not a grant-funded program,
yes,
right?
It is not grant-funded, and that is unusual for public health. We get a lot of things that are grant-funded, so we often have to decide how we can meet local needs with the parameters that the state or the national funder have set for us. And that's been a benefit of our program, that we have 50% of our funding from county general fund and then 50% from the district's student investment account. And so we've been able to assess what do our schools, what do our teachers, our staff, our students, our families, community partners say we need to focus on? What's our priority here locally? And then we design our program around that. So we're still using the effective best practices for this work, but we're able to target the specific student health needs that we need to target. In Oregon, we have a Oregon Healthy Schools program. It funds the Oregon Department of Ed, and it funds one school district. And they focus on nutrition, physical activity, and chronic disease management. And when we've talked about whether we wanted to have one of our Central Oregon districts proposed as that main district that gets this program, we had difficulty getting kind of a seat at the table because physical activity, nutrition, though it is important and we all recognize that it is, it's not the critical thing that's of concern. Mental health and social health, student substance use, that has been the critical thing that our community wanted to focus on. And so the local funds has allowed us to be able to really prioritize those needs and do what the schools really needed us to do.
But that's pretty cool.
It is very, very cool.
Yeah. Because, usually money's a concern.
Well, it is always a concern in public health.
Still a concern too, right? Is that why other districts aren't jumping on board with this? Why is this not more of an effort statewide, nationally? Why is this not something that more people are doing, more school districts?
I think that's a loaded question.
That's what I do here.
Yeah.
Put you on the spot.
Yeah. I think one thing that I'm seeing is that a lot of the funding that is going through the education system is really designed and earmarked by educators or legislators. And we don't know what public health could be doing inside schools. because we don't really have a strong understanding of the value that we do, I should say. That's why we've invested in this program. But what we've learned is that, especially in Oregon, schools are being asked to do more and more things that are essentially public health. And people aren't realizing that that's public health work, that we're trained, we have expertise, we have skills for this. And educators are not trained in how to do these practices, and they are trying their hardest, and they're burning out. And it's difficult for them to know how to address these issues because they don't have the training to know, how do you really make a large change that's going to address and prevent these concerns that we're seeing as there's a public health concerns. And how do you address them with public health methods, not educational methods?
That's tricky.
It is very tricky. And so I think just in our nation and in the state, we haven't really braided our public health and our education systems well. So we're operating in two silos, and that's how you usually see it. You see your local public health authority trying to prevent all of these emerging issues with our effective strategies, but we're not in the systems and locations where people are. So what we've done here is we've put our public health staff inside the schools where 95% of our school-age kids are. And then we reach families through the education channels, like you're looking at your school's newsletter, and you're going to get prevention messaging now. And so that makes a lot of sense. It's a very efficient and effective way to do prevention work.
I mean, you got to be pretty proud of this program.
I am so proud. This is my life's dream.
And your team,
So,
and you were a teacher.
I was a teacher, and I left my classroom because I wanted to do more. I saw the things that we had that were barriers to learning, and I wanted to do things through my school to make my students healthier so that they could learn better. And so I was able to get a doctorate, my master's degree, all specializing in running school-based prevention and health promotion programs. And now Deschutes County has made a program just for me.
Look at you.
And I get to live my dream. So.
Just for Aimee Snyder.
Yes.
Yeah, that's awesome. That's so cool. I can see you beaming with pride. Yeah. Because the impact that it has on the kids, right? I mean, just the fact that you can help and you're in there. Mm-hmm. You're in there right there next to them. You're not doing it after the fact, a week later after they get an appointment with somebody, or something to that effect. And that's probably an exaggeration. I'm not a parent, so I don't know, but I'm not a teacher either. But I know that the fact that you're just right there, the stories you must hear of success, of impact, of even the struggles, right, are probably just immense. Mm-hmm. How do you navigate those feelings? Because, you got the success stuff, and then you got the stuff of, man, we got more work to do.
Yeah. I think this is a common challenge doing prevention work. We work long-term, and so we are often working with people who are experiencing what feels like crises because they have students who really need help now. And it's often an overwhelming amount of students that we're experiencing right now that need help. And we are often there aiming to get in front of this and say, well, what can we do to prevent more students from falling into this pool of students who need a lot of help? So we've been fortunate that we can work two levels at the same time of what's our systems of care that we have. We have really great school-based health centers. We can route students to those school-based health centers and start utilizing our community resources a little better. It's difficult for schools to know what are those community resources that are available to them. And that's our job, is to say we don't provide treatment, but we make sure that staff and students all know what are the sources of care that they can go to, or what are some other types of help resources that they can get. And so that might be a school-based health center, or just reminding them you can talk to your primary care provider about this and ask them for a referral. Or we have Youth Line, or we have 988. We have a ton of different types of resources. And while we're doing that, we're also laying the groundwork for what's going to be the system of supports that we do for prevention too. So we're doing these long-term plans, and we're at a great point in our program where we're seeing those initial first years plans turning into actions. And now we see more and more people getting involved, and things are kind of rolling on their own, and we're starting to see results. And it's just a very great time to be in this program, to see the fruits of the labor, I guess, and seeing, everything that we knew would work, working.
Have you seen like kids taking the ball and running with it?
Oh, yeah.
I mean, I think, and I'm probably not recalling the student correctly, but down in Lapine, graduated, and like that became his mission in life, is that he wanted to kind of keep carrying it on.
Yeah, that student is at Johns Hopkins studying public health, which makes
That's so
me
cool.
proud as a former. I was an instructor at Oregon State University, and I taught undergraduates in public health. And to see students from high school know what a public health field is and know, I want to get a degree and I want to do this work. So we are also exposing kids to another field of profession that they may not have ever been aware of. Prevention is a whole field that you could get into and do work in any kind of subject or topic area that you're interested in. And it's a very nice, it's a health career that is very much filled with hope, because you're improving things, you're making things better, and you're preventing them. Whereas you see in some fields where if you're a treatment provider, you sometimes have difficulty with that emotional labor, and seeing kind of continually to see people, though you do have success stories in treatment, but sometimes it can be a little bit harder in those fields. And we are lucky that we're a field where we get to see a lot of positive changes, a lot of hope kind of grow out of our work.
So we're coming up to the end of the school year, a couple months away. I mean, looking back at this school year, like, what do you see?
Yeah.
I mean, like, success, challenge, struggle. I mean, looking back, I mean, it's always the time to kind of evaluate, kind of how did we do, right? And,
Yeah.
And look at the impact you had. And then you get a little bit of a break, and then you got the school year to come. It's like, what's next? So take me back, look backward.
Yeah.
And then take me forward. What do you do next?
Yeah, this is, you might have to remind me of that second part.
I can do that.
So this is our third year of doing Healthy Schools, and we started with a phase-in approach. So we started with myself and 2 schools, then we expanded out to 9 schools total, and then now we are in all 14 middle and high schools in Ben Lapine schools. And it has been a phenomenal year of just having all schools having this access to this service, and then seeing how we have really become integrated with the schools in the district, and how we really have this interdependent kind of relationship on each other, that we have some woven together like budgets, and we really are treated like district leader and school staff. And we have been able to co-create some plans, and I think the biggest success that we've had this year was starting Sources of Strength in 11, well, now we're in 12 of the 14 schools, whereas before there was just 1 school that had
Explain
been
that a
doing,
little bit.
Yeah.
What's Sources of Strength?
Sources of Strength is a research-tested program that is effective at preventing suicide. It also can be effective at preventing substance use and violence. It is a student-led mental health promotion campaign. So students are trained to be leaders and to design and implement school-wide campaigns that engage their peers in reflecting on what are their strengths, and then building those strengths. And the cornerstone of this program is the Strengths Wheel. If you go out to the Bend Marathon 5K this weekend, you might see students with the Sources of Strength flag, and you could ask them about what is Sources of Strength. And they'll likely say these are the things that you draw on that help you become more resilient. So when you experience a challenge, you might have family support, positive friends, a mentor that you could go to. You might have healthy activities where you can kind of vent or express. Like if you play softball, you might go batting too. If you've got a lot of energy and you're like, that didn't go well today, I'm going to go bat. Or, you might color or read or do something just to kind of self-soothe. So things like that. There's 8 categories that we teach the students in, and then they engage their peers in those activities. Trying to think, what else did I want to say about sources of strength? The students aim to do about 2 to 4 campaigns a year. Right now, we have a student who's leading a campaign to bring people together to do the Bend Marathon 5K or to cheer for runners at the 5K.
That's so cool.
Or just to be there to talk to people about sources of strength. So that's just an example of one.
Very cool. So that's kind of looking back. So, I mean, it sounds like a big success there.
Yes.
Take me forward. What's next for this program?
Yeah.
I assume more people. How do you get into more schools, more districts?
Yeah. Well, right now we're just in Bend Lapine schools, and it does take a while to plan out a budget because it is a large budget. We've got 6 of us. Every large high school gets a public health specialist in this model. And so if we were adding more schools, we would have to come up with the budget of how we would fund those staff.
That darn budget.
Yeah, budget's always the challenge.
It'll get you.
Some states have legislated having a healthy schools program, or what's called a coordinated school health program. And so, for instance, Tennessee has legislated that they have an office of coordinated school health at the state level, and then every district has a school health coordinator, which is essentially the role I serve. And then every school has a school health coordinator, which is the role that my public health staff serve. So there are ways to fund it at a way that's not just the local level and district by district. But right now, we could expand out if we had the agreement from the organizations that would need to pitch in to cover it. So right now, we're just staying with Bend Lapine schools unless discussions happen.
You never know.
Yeah.
They already carved you out a whole program. So, you know, what else is next for Aimee?
I would say we have perfected our model, so we are ready to expand.
Let's go. Let's do it.
So we have shown that we can expand because we did expand over the last 2 years in Bend.
That's awesome.
Yes.
A lot of good work.
Yeah.
A lot of good stuff as we're in this eclipse season.
Yeah.
You're kind of a ray of sunshine for students throughout the county, and that's awesome. Doing great work. Your team's doing great work, and it's just really exciting to hear about it. Is there anything else you want to share that perhaps I didn't ask you that I don't know what it is? I mean, it's not school lunches.
Nope, it is definitely not school
that.
lunches. And it's also not doing the work of education. We are very much doing public health services in schools. And schools just happen to be asked right now to do more and more things that are public health services that they're not trained to do. And so that's been the benefit of this program, is that we've realized that these are the strategies and skills that we bring to the table. And we've had a district that opened their doors to us to say, yes, have a seat at the table, come and work with us through these problems and challenges and give us advice and guidance. And we're going to work alongside you, and we'll put these public health approaches into our school system. So that's really been quite the that's what makes me very happy as a former teacher
it's
who's
just a
in public
great
health
collaboration.
now.
And you used the word braiding. I think that visual is perfect for this. It's just kind of the intertwining of the school district and public health and helping the students along the way with these issues. What a cool program. Congrats on all you're doing.
Thank you.
Kudos to you, Aimee Snyder with Healthy Schools. Thanks for being here.
Thank you for having me.
If you have a question about the Healthy Schools program, you can go to their website, deschutes.org/healthyschools. There you can also watch a video about the program. You can read their annual report with results from last year. Lots of good information there. If you have ideas for this podcast, you can email us at info@deschutes.org. Remember to subscribe to the podcast wherever you listen to your podcasts. We're on Apple, Spotify, Amazon Music. You can also find us on YouTube Music now. And you can also find us on deschutes.org/podcast. But until next time, be safe out there.